The fight against the virus pandemic is constantly evolving, and we are more than 5 months into this health crisis, in case you're still counting. As always, to sort through all the developments, we are joined once again by our medical expert, Dr. Arnold Baskies. He is joining us live, past chairman of the National Board of Directors and the American Cancer Society, as well as the chair of the Global Cancer Control, oh my goodness, so many titles, Control Advisory Council. Welcome, Doc. Good to see you again.
Good morning, Lucy.
It's important to get it all in, though. All right, flu season. We've been talking about the pandemic, but we also spoke about this last week. The experts are worried about a twin-demic overlapping because of COVID and the flu. What do we know about how the flu and COVID interacts?
So there's been tremendous interest in this particular issue all of a sudden. But what we have to remember is co-infections, infections with two respiratory viruses, is extremely rare. Will the flu season necessarily make the COVID situation worse? The answer actually may surprise you. I believe the answer is no. The situation may not be as dire as some people have predicted. In March, the southern hemisphere of the world braced for its flu season. Very good medical personnel in South Africa were hoping to study the interactions between the flu and COVID. And guess what? The flu season in South Africa never came. In all of South Africa, only one case of the flu was discovered and reported. Now, some cases may have been overlooked, but it's impossible that their CDC missed all the flu cases. Apparently, in South Africa, in the southern hemisphere, travel restrictions, social distancing, mask wearing, all but stop the flu dead in its tracks. So if we are careful and do the things that we know work, we could avoid a bad flu season that would add to our suffering. And be advised, AstraZeneca and GlaxoSmithKline have produced about 200 million doses of the flu vaccine. So get your flu vaccination.
All right, that's good advice there. Researchers at the University of Washington released new projections this week of possible deaths in the U.S. from COVID. They actually studied 3 different scenarios. What did they find?
Well, 300,000 is the number that by year end is their grim projection. When they send me their output from the University of Washington, and their numbers get picked up by the public, what we have to remember is that these are projections. They are not facts. Bear in mind also that the University of Washington is one of 26 institutions that make predictions about COVID, and it hasn't always been the most accurate one. In fact, researchers at Iowa State disagree with their projections completely. They are basing their statistics on the following assumptions. One, that the hardest hit states probably won't bend their curves very much. Number 2, starting in November, cold weather could turbocharge the cycle. Things could be worse than projected if really hard hit states don't return to possible lockdowns. New solutions, however, can drastically change their model and their dire predictions. What are the things that we can do? Mask wearing, bar closures, indoor dining closures, businesses that get aligned on practices to try to keep their employees safe. All of those things can change their model. So don't pay so much attention to projections. The real value of projections is less about providing a hard number of how many deaths to expect, and more, the projections are more about helping to flush out the impact that we can have with different solutions. So that 300,000 number is not a hard and fast number. There are other models that disagree with it.
All right, let's get an update on this race for a vaccine. Moderna launching large-scale clinical trials. They're looking to enroll more minorities as patients. Tell us why that is so important right now.
Well, as you said, Moderna is moving ahead very quickly. It's located in Cambridge, Massachusetts. They're doing unbelievable work right now. They've enrolled minorities at levels, unfortunately, that are 3 times lower than those that have been requested by Dr. Fauci. Moderna is aiming to recruit a total of about 30,000 volunteers into the phase 3 trial, which is very, very important. 18% of the volunteers so far have been from the minority population in the United States. What Fauci wants to see is that the minorities are enrolled in the trials at levels which are about double their percentages in the general population. That translates to about 66% of the volunteers that should be from minorities, according to to Dr. Fauci. And that's a reflection of the fact that the minorities in this country have been more adversely affected by the coronavirus. Moderna, for its part, is trying very, very hard. Moderna has selected about 100 clinical research sites that have representative demography. The demographics are such, and that it will be possible to get a substantial percentage of the people enrolled in the trials from minorities. So they've announced that so far they've recruited 13,000 participants in the trial. At that pace, the company will easily enroll 30,000 participants by early to mid-September. So we will know the results of that trial by mid-September. Hopefully they will be able to get the number of minorities up so that they do make the benchmark that Dr. Fauci wants to see, but it's very, very important.
It is incredible how people of color have been impacted so much more with this virus. Now, you said that you think we may have more than one effective vaccine. So at this point, if there is more than one available, should you get more than one? And if not, how do you choose? How do we choose which one we get, depending on what kind of immune issues we have? What do we do with this?
Well, Lucy, I think what our viewers really need to understand is that vaccines are the best defense against infections that may have serious complications. And we have other vaccines that we've been able to take advantage of. Vaccines from measles, mumps, rubella, hepatitis, and even vaccines against cancer like the HPV vaccine. So we should be thankful that we've conquered those diseases because of vaccines. By November, I'm certain that we will have more than one effective vaccine against COVID. By that time, there will be millions of doses of different safe and effective vaccines produced. There should also be some plan in place about who will be able to get the vaccines after they're approved. So should you get more than one vaccine? The answer is no. We will only need to get one vaccine, but be aware that the early use of the vaccine will probably be for people who are in the high-risk category, such as healthcare workers on the front lines. But it will be a hands-on-deck approach to the use of vaccine. And I predict, as well as other people have predicted, that the National Guard will be called in to help administer the vaccine in every part of the country. So should you consider getting more than one vaccine? Probably not. It probably will require, by the way, one shot of a vaccine, and you probably will require a booster shot subsequent to that. So we should be happy that we're going to have a vaccine, but I don't think anybody's going to need to get more than one.